Welcome to Ross University School of Medicine's Procedural Skills Introduction to Ultrasound Lecture presentation. I am Dr. Brenton Otey, and I will be guiding you through this lecture. Before we get started, let's discuss the objectives here. Our goals are to explain the basic principles of the physics of ultrasound, provide students with knowledge of instrumentation, discuss the advantages of ultrasound, discuss the limitations of ultrasound, discuss the classical appearance of normal structures on ultrasound and common pathological conditions in ultrasound, and to discuss appropriate indications for common ultrasound examinations. Now let's discuss some of the basic principles behind the ultrasound. How do we get the image? How does it work? How do we optimize the image? What are artifacts and what are the common ones? How do we report the findings, and what imaging modes are even available? We're going to talk about all of these things throughout the body of this presentation. For the physics of the ultrasound, there are several different components that we have to examine. The nature of sound waves, wave properties, the effects of different tissue densities, and the tissue interface itself. In its most simplest terms, the way we get our image is the transducer of the ultrasound machine sends out a sound wave towards the desired object. The sound waves are then reflected off that desired object back towards the receiver, and then this interpretation gives us the image that we see on our ultrasound machine. Now, let's go into some of the terminology. Scattering occurs when a sound wave strikes a structure with a different acoustic impedance to the surrounding tissue, and which is smaller than the wavelength of the incident sound wave. What do they mean by acoustic window? This is basically your field of view. This is the location from which an ultrasound probe makes its scan. The probe can be turned and or angled in a different way, which would yield a different view, but they are all from the same acoustic window. How do we acquire the best ultrasound image? Well, there's a few settings that we can adjust in the following order, starting with depth, focus, time gain compensation, zoom, gain, and dynamic range, all of which we'll go into detail a little bit further on in the lecture. When we say depth, we mean that you can increase the depth if you are looking for a deeper structure. Pretty intuitive. In terms of focus, this means there is an optimum depth that the object of interest will have the best lateral resolution. Resolution meaning the ability to distinguish two objects. Activate the focus function and then use the trackball or touchpad to adjust the arrow to the same depth with area of interest. The deeper a structure is, the darker the object will appear on the ultrasound machine. By using the time gain compensation, you can manually adjust the amount of brightness at a certain depth of the image while leaving the rest of the field unaffected. So it basically makes the image look a little bit brighter compared to the rest of the field. Zoom is used to magnify small objects, but keep in mind that the image will or may become grainier the more it is magnified. Gain allows for the modulation of signal strength that returns to the probe. You always want to increase the gain if you're looking at an object that is echogenic and decrease the gain if an object is anechoic, because the more energy that is coming back, the brighter the image will appear on the screen, and vice versa for less energy. Term dynamic range refers to contrast. If you are scanning a structure with reflective properties surrounded by layers of soft tissues, you may want to lower the dynamic range. By doing so, the one with the strong echogenicity will be the object which stands out. Some important posterior acoustic properties to understand include posterior enhancement, attenuation, and acoustic shadowing. Acoustic enhancement, also known as posterior enhancement, refers to a phenomenon where there are increased echoes deep to structures that transmit sound exceptionally well, particularly fluid-filled structures such as cysts, the urinary bladder, and the gallbladder. Attenuation in ultrasound refers to a reduction in the amplitude of the ultrasound beam as a function of distance, meaning that the deeper a structure is, the more that the ultrasound wave will be attenuated. Acoustic shadowing is a type of artifact on an ultrasound image, which is characterized by a signal void behind structures that strongly absorb or reflect ultrasonic waves. It happens most frequently with solid structures, as sound conducts most rapidly in areas where molecules are closely packed, such as in bone or stones. Now, I just briefly used the word artifact, but we haven't talked about exactly what artifacts are yet. So, what is an artifact? It is any alteration in the image which does not represent the actual image of the area being examined. And there's multiple types. There's shadowing, which we discussed, reverberation, which appears as a series of equally spaced lines, as you can see on this image here. There's mirror imaging, which happens when there's a strongly reflective, smooth, curved interface, which may reflect the sound distally instead of returning it to the transducer. And then acoustic enhancement, also known as posterior enhancement, which we just discussed. When discussing the images of the ultrasound, we discuss them in terms of echogenicity. So using your Latin prefixes, iso meaning equal, hypo meaning under or below, hyper meaning over or above, and an, well, specifically a, meaning away from. So iso would be it is equally as echoic as the surrounding tissue. Hyper would be something like a bone or a stone. These are very solid. They would reflect very well. Hypo would be something that does not reflect as well, but is not exactly the same density as the surrounding tissue because it's not iso. And then anechoic would be something that does not reflect at all, and that would be something like a fluid-filled structure such as a cyst or the bladder. As we just discussed, different structures have different densities and therefore will reflect sound waves differently, and an ultrasound can be used to help distinguish all of these various characteristics. There are also a variety of imaging modes that can be utilized on the ultrasound machine. There's the B mode, which is grayscale, Doppler mode, and M mode, which can be used to detect motion. Let's talk more about the instrumentation. We have the basic probe and the image orientation, which can be sagittal, transverse, or coronal. Our transducers, which operate at different frequencies. There's different types. They can be linear, curvilinear, sector, transvaginal, near field, or far field. There's the different machine settings, which we already covered in detail. And there are also control buttons you can use to freeze frame, save images, create a loop if you're taking a motion video, or measure with calipers. There are lots of advantages to ultrasound. It can show you real-time dynamic imaging. It's safe and non-invasive. You can also have multiplanar imaging. It's more portable than, say, an MRI or a CT scanner. There's no ionizing radiation. It's lower cost to the patient. And it's improved soft tissue resolution compared with non-contrast CT. There are also multiple limitations to ultrasound as well. If you're dealing with an obese patient, you can deal with attenuation and scattering and image degradation. There could also be impedance to transmission of sound waves in the patient. The ultrasound generally has a much smaller field of view than other imaging modalities. It's also very operator dependent, and there's less inter-examination reproducibility compared to something like a CT scan. Here you will find a list of structures and procedures that we generally can detect and use ultrasound for. Now take the time to familiarize yourself with some ultrasound findings. Let's start with the abdomen. Here's a slide just showing some representation of what you may find on an abdominal ultrasound and what those structures may look like. An ultrasound is also what we use to make the diagnosis of cholecystitis. Looking for a wall that is more than 3 millimeters in thickness, you can also look for pericholecystic fluid with or without the presence of stones. And here's an example of what it would look like. While current guidelines suggest that the imaging modality to make the diagnosis of appendicitis is an abdominal CT scan with contrast, you can use an ultrasound to make the diagnosis in a patient who may be not able to receive a CT scan, whether they have contraindications to the scan itself or to the IV contrast, perhaps such as a pregnant patient. And this is what it would look like pictured here on this slide. The focused assessment with sonography and trauma, also known as a FAST exam, is a rapid bedside procedure which can be used in the emergency room to look for internal bleeding in trauma patients. And here is a FAST image of a spleen, just to give you guys a better idea. And on the next slide, you'll see another FAST exam of a liver. This next slide shows how we can use the ultrasound machine to take an echocardiogram. It represents how we can manipulate the acoustic window in order to get different sections of the object that we're trying to observe. In the following slide, we have different sections of the heart and how they are visualized on the ultrasound. And this continues further on the next slide. Here we have another example of a FAST examination, but this time it is observing the heart and we can see the presence of a pericardial effusion. As you can see, there is a thin layer of fluid within the pericardium. Here we have an example of using ultrasound artifacts to distinguish normal from abnormal or pathologic. On the left, you can see in the normal lung, we have the reverberations present, and the comet tails, which would move with respiration, are not present on the right side. This is because instead of having the normal lung tissue in a patient with pneumothorax, in this space you have air. Instead of air in the chest cavity, as in the previous slide, we have an example of a hemothorax in a patient. As you can tell, you can see the blood versus the diaphragm and the spleen pointed out by the text and the arrows here. And notice how they vary in echogenicity. In this slide, we have a screen capture of a carotid Doppler. The next slide, you can see an ultrasound of the right internal jugular vein, which was taken for a patient who was undergoing a central venous catheter procedure. In this next slide, we have imaging of an aortic dissection from two separate views. We have the transabdominal ultrasound on the left, which details the dissection flap and the aorta. And then on the right, we have the transesophageal echocardiogram. Ultrasound can also be used in a duplex scan for the detection of deep vein thrombosis. On this slide is a FAST examination of the pelvis, examining the urinary bladder. As you can see, the darkly shaded region is the anechoic region, which is generally characteristic of fluid-filled structures, such as the bladder and cysts. The versatility of the ultrasound machine allows us to examine not only the urinary bladder, but also the uterus, the ovaries, and the prostate as well. Our ultrasound images of a bladder, as you can see the anechoic region in the center. On the next slide, an ultrasound image of the prostate. You have the bladder labeled there, if you remember, the anechoic region because of the fluid, and then above, you can see the prostate, which is labeled. Next, we have a longitudinal view of the uterus during a transabdominal ultrasound, visualized in the image on the left. In the image on the right, we have a longitudinal view of the uterus during a transvaginal ultrasound, which allows you to get a different section, visualizing the endometrium. Ovarian follicles are fluid-filled structures, which make them very easily visualized on an ultrasound scan. And on this side, we have an obstetrical scan, and you can see the yolk sac, the fetal pole, within the uterus. There are a multitude of indications for ultrasound examinations. Some include characterization of masses to identify if they're cystic, solid, or complex, which could potentially be indication of malignancy. It can also be used for the evaluation of right upper quadrant pain, evaluation of pelvic masses, pelvic pain, abnormal vaginal bleeding, evaluation of palpable neck and thyroid masses, renal failure, hematuria, flank pain, and evaluation of scrotal pain and scrotal masses, just to give a few examples. And on this slide, we have a list of the most common ultrasound investigative studies.